Wi-Fi is good. We'll see. Okay, perfect. All right. Hi, everyone. Happy Tuesday. Happy Trendy Tuesday. I hope you're all doing really well and just having a safe spring evening. It's starting to get really nice out, at least here on the East Coast. So hopefully that is everywhere as well. I heard it snowed in Chicago today, so maybe not everywhere. But
Wow.
yeah, but happy to be where it's warm and wherever you are. I hope you join and learn some stuff with us tonight. So, as usual, I am joined with the lovely Dr. Sophia Yan, our CEO and co founder of Pandia Health. And we'll be discussing one of the trending birth control topics this evening. And you can join us on our past lives, they're all posted, as well as our upcoming lives. And we cover just lots of important topics. So, if you know nothing about birth control, if you consider yourself a birth control expert, here's a great place to be. So tonight we'll be kind of talking about the basics. So birth control accessibility, what to do if you've never taken birth control and you're not sure where to start, or if you're someone who's been on birth control for a while, but you're maybe considering switching it up, you are kind of stuck in your current situation and not sure what to do next. We're going to be covering all of that. So as usual, feel free to leave us a question, any comments, say hi. We're happy to help out. I'm with the expert. So now is a good time to get your questions out. So hello, thanks for joining, Alec. Without further ado, let's get started. So first question, we're going to kind of just start generally. So say someone is wanting to start birth control, but they're not exactly sure where to start. What would be a good first step for them?
I would say that, if you have access to a doctor or health practitioner or health educator to go talk about your options there, but bedsider.org or Power to Decide is also a great resource. They have different videos on like the person with the uterus says, the person with the penis says, assuming it's a heterosexual relationship and you're using it to prevent unplanned pregnancy. And different people who've used it and what they felt about it, the side effects, how it works, how it doesn't work. Planned Parenthood is also a great option as well. We have lots of videos on YouTube. If you Google Pandia Health on the pill, the patch, the ring, I think we are the best source of information on the pill, the patch, the ring. But if you're trying to decide from all your options, which IUD, implant, shot, etc., then go take a look at Bedsider or Power to Decide. I forget which name they're going by lately. Talk to your doctor, talk to a health educator. Don't just rely on what friends say because, just because one person had this amazing effect or one person had a horrible effect, each person is different. And so go with the broader thing rather than one random anecdotal situation.
Cool. Yeah, I totally agree on that. And I think what works for one person might not work for everyone. So say someone, a friend of yours like loves the IUD, but you don't want something up there. I totally get that. Then you might want to explore another option like the implant or the pill or things like that. And it's also good to speak with a doctor just so they know any previous health conditions that you have or your family might have. For instance, blood clots. We talked a little bit about that last week. That's kind of a hot topic right now. That's really good for them to know just so they can make an informed decision based on that versus you just being like, hey, I want to go on the pill. Great. Glad you know. But good to bring it back first. So that's step one. Step two, you're like, okay, cool. I'm on board. I think I want to start birth control. What would kind of be the next step in actually going ahead and getting your prescription and accessing it somewhere?
Yeah. So if you want the IUD or the implant, you're going to have to go in somewhere for them to put it in. So that would be that step. If you want the shot, same thing. And if you want the pill, the patch, the ring, you now have the option of doing it online. And with Pandia Health, we will take care of you for the great steal bargain price of $20 once a year, which then gives you an entire year's access to our physicians for follow-up in case you have any side effects or stuff like that. If you've been on the same pill forever and you love it, then just go with it. But if you're changing or you're new, it's great to have, expert doctors that provide expert care.
Definitely. Yeah, it's great that you can now access things online and not have to go pick it up. I know I still have to get some of my other medication at the pharmacy, and I'm always like, oh, why can't this be delivered? But it really makes a difference. It's a big game changer for sure. I mean, we have better things to do. Hashtag better things to do than go and pick it up. So I think that's really awesome what Pandia is doing. And again, if you don't live in the states that we prescribe to 9 states, if you don't live in those states, that's okay. You will need to have a doctor prescription, but you can still order. We deliver to all 50 states. So for instance, I live in a state where Pandia doesn't yet prescribe to, but maybe DC eventually. But I can still get my birth control delivered to here super easy. So very good things to do. So this is kind of a two-part question. The next thing, do you need to get a pap smear in order to get prescribed birth control? And then kind of going off of that, if you do go in for an appointment, whether it's a pap smear or just like a birth control consultation, what are some things you can expect there? Because it can be a little scary going into that.
Yes. So you do not need a pap smear in order to be on birth control. Oftentimes physicians will hold birth control hostage. If you don't come in for your pap smear, then you don't get your birth control. And that just, the two issues are separate. One is preventing unplanned pregnancies or treating polycystic ovarian syndrome or treating bad evil periods. And the other is preventing cancer. It would be nice if you get your pap smear, and you should start getting a pap smear at age 21. And then I have to look up the latest recommendations, but I think if you have 3 negatives in a row, then you can go to every 3 years or something like that. But you don't need it before the age of 21. If you're still going to some old school OB-GYNs who haven't kept up with the literature, they may try to pap smear you before 21, but you do not need a pap smear in the United States until 21, unless you're immunosuppressed. So certainly if you have HIV or you're on chronic oral pill steroids, not just the inhaled steroids, those aren't strong enough to suppress your immune system. Then if you don't have either of those, no pap smear until 21. But regardless, shouldn't hold your birth control hostage if you don't get your pap smear. If you're 21 and you're going in for your annual pap smear or older and you're supposed to get one, then if you've never had a pap smear, what that entails is you've probably seen those stirrups in a movie where a woman's like giving birth or whatever, but you put your feet literally in these stirrups, kind of like the horse riding a horse thing. And it puts your legs spread eagle. And the whole idea is to visualize your vulva. But then they put in a speculum, and that speculum looks like a duck's bill, and it can be duck lips. It can be either clear or it can be metal. The metal is stronger. The clear is cool because they have the technology. You can put a light in and then it lights it up and you can see stuff for the physician. Whereas the old school with the metal, I have to put it over my head and it has to like crank it in. But if you've got strong vagina, then I've seen it crush, not crush, but like we have to open it up so we can see, and then like kick. And it's like open it up, kick. But the metal one stays open. The metal one, sometimes we can warm it too. The plastic one's nice because it isn't cold metal. The metal ones are absolutely safe and clean. We autoclave them, which means it kills any living thing because it's that hot. And of course, we chill it before we don't chill it, but we let it cool to room temperature before we put it in. And so the physician will slide that in. It's probably the most uncomfortable part of it for me, I thought, not as a physician, but as a patient. And then they'll put in a Q-tip and it'll sample some of the cells of your cervix looking for cancer. And they'll send that off either on a slide, or the new one is a liquid prep. So it just floats in there and then they put it on a slide and look at it. And then if it's a liquid one, they can also send it to test for the dangerous HPV, human papilloma virus, because there's like wimpy HPV, which doesn't result in cancer. And then there's the high risk HPV, which results in cancer. And if they do that HPV test, then I think that's one of the goes to having your test every 3 years, every 5 years, if you don't have a high risk HPV. So, but TLDR, you don't need a pap smear. Be nice, but you don't need it. The other one is you don't need a sexually transmitted infection disease test. It would be nice, but you don't need it.
Okay, cool. And then if you were just doing a consultation, for instance, a Pandia consultation, what are some things you can expect from that? Not a pap smear, just kind of like talking about birth control.
Yeah. So Pandia Health, we assume that you know if you want the pill, the patch, the ring. We're not here to educate you or whatever. That you need to do on your own. See your doctor, see a health educator, bedsider.org, power to decide. But you know if you want the pill, the patch, or ring. And with that, we ask you the same 20 questions I'd ask you if you came in my office. So if you came in my office, same exact 20 questions. But the beautiful thing is everybody gets asked all the same questions so we don't miss anything. Because sometimes if the doctor's distracted or it's a medical student and they forget, or we wander off and we're talking about your asthma and PCOS and I'm like, oh, I forgot to ask about liver cancer or something like that. But that is the beautiful thing of a questionnaire, is we always ask the exact same questions so that we don't miss a thing. And because of that, we've picked up a couple patients that should not be on a normal birth control with estrogen because they're a smoker and 35, because they have a history of personally of liver cancer, or they have lupus with antibodies, or just stuff that their doctor might have missed, or that maybe you got in the past year. Like you had migraines and migraines is fine, but now you have migraines with flashing lights and part of your body doesn't, then that's not okay to be on estrogen. So these 20 questions have been approved by the state of California's medical board, pharmacy board, and the American College of Obstetrics and Gynecology of California for pharmacists to prescribe birth control. And then we added a layer of doctor on top because I'm a doctor and I have more questions that I want. But this is approved by the state of California for pharmacists to write birth control. So anybody who wants to question the questions, they have been approved for someone lesser than a physician to write a prescription. And we've added a layer of physician on top. And notice that Hui Ying has a great question. If I'm not sexually active, do I need to get a pap smear? So if you've ever had vaginal sex, then you need a pap smear at 21. Though if you want to be technical, and we are the only doctor-led, academic doctor-led company in the birth control delivery space, generally you can wait until 3 years after your first heterosexual vaginal experience. And we used to pap everybody as soon as they had sex. But then we realized 80% of people will get rid of the HPV. And so we like flip out and be like, oh, you have an abnormal pap smear. And now we're going to like cut out parts of your cervix and stuff like that. When in fact, your body would have gotten rid of it 80% of the time. And so now we give you 2 or 3 years to get rid of it. And then we check. And if you still have it at that time, which is 3 years. So then the new rule was 3 years after the person had sex. And so if you're 21 and you've never had heterosexual vaginal relations, you technically do not need a pap smear. You can wait 3 years after you've had sex. And in Europe, they actually do it at 25. And it's just a question of threshold. So in the United States, I don't know the exact number, but if 1 out of 100,000 people die, then that's a travesty. And they would rather pap 99,9999 to save that 1 out of 100,000. Whereas Europe has a higher threshold and they're like, no, I don't want 99,999 women to get pap smeared just to save that one. I'm willing to let it hit, a higher number or something like that. And that's why their cutoff is at 25.
Gotcha. And it can also detect for cancers, right? So it's still good to get one even if you're not having sex.
So it's only testing for cervical cancer, and cervical cancer only happens with the HPV vaccine. There is no known case, not vaccine. Did I say vaccine? HPV virus. The vaccine protects you against this.
Right.
And so if you are a nun who's never been sexually assaulted, or have been a nun and was sexually active and then became non-sexually active, then you wouldn't need a pap smear.
Wow, I actually did not know that. I thought it was just like a regular health screening check, but that's really good to know. Wow, okay. But yeah, so I guess the answer to that is if you haven't had sex yet, then no, but afterwards, yes.
Yeah. And when you say sexually active, I was like, maybe you're in a dormant season.
You're right.
You did it in the past. So that's what, if you ever had heterosexual vaginal sex, you should get a pap smear. And then women who have sex with women, sometimes one of the partners has had heterosexual, and then they play with a dildo or something, and that could give you, so you need to just, then we still check, because unless you were both lesbians your entire time and never touched anybody of the opposite.
That makes sense. Yeah, really good to know. And kind of the last question. So if someone is under 18, so under the age of consent, do they need parental consent to get their birth control? I know it kind of varies based on states, but it would be nice to clear that up.
Exactly. So it varies on states. It depends if your state is liberal or conservative. Liberal states like California and Washington, and oddly enough, Georgia, allows for anyone of any age or at least 12 and up to consent to the prevention of unplanned pregnancy, because their public health officials and the American Academy of Pediatrics agree that it's better we prevent unplanned pregnancy, that you see a physician, than you end up pregnant at age 12, 13, 14, 15. Certainly as a physician, we're mandated reporters. So if we think you're 12 or 13, maybe you're being, taken advantage of, then I do have to report that. But that's of my own, opinion, etc. An exception to all of these is Title X family planning clinics. So all the states should have Title X family planning clinics. And if you Google Title X, because that's the Roman letter 10. I don't know why they put the X, but that's how they did. Title X Family Planning Clinic, the federal law supersedes the state law. And the federal law says anyone of any age can consent to the prevention of unplanned pregnancy. And so if you go Google a Title X clinic, go to a Title X clinic, there, a teenager in a state that law says you have to tell the parents or you have to get parental consent, doesn't apply because it's federal, and so federal supersedes the local. But a good resource is the Alan Guttmacher Institute. If you Google minor consent, birth control, Alan Guttmacher, then it has a table of all the states, and it has a row, parental notification, parental consent. If you serve in the military, or if you're already a parent, then usually you can consent for stuff. But there's like weird, wacky laws. You just have to check state by state. At Pandia Health, in the 10 states that we prescribe, we have looked up those laws and made sure that we follow those laws, because we are not a Title X clinic or provider. We have to follow the laws of every state.
Cool. So I think I've asked you this before, but I feel like something good to cover. If someone is under 18 and they want to start birth control and they're nervous to talk to their parents about it, how can you start to address that conversation? Do you have any tips from both, like being a doctor and a parent and formerly a woman on birth control?
Yes. I think there's two ways to go at it. One is, both are depending on your relationship with your parent. One, you can be just frank. I'm sexually active. If I don't get birth control, I'm going to end up pregnant. 85% out of 100 people that have sex without any kind of birth control will end up pregnant. Two, you can go about it in a different way, which is we're really trying to educate anybody with a uterus that you can make #periods optional. And the method to get there happens to be birth control, the pill, the patch, the ring. And as a tiger mom, I'm pitching to all moms out there, all parents out there, that is your 15-year-old. My 15-year-old is going to crush your 15-year-old on the SAT, because my 15-year-old will not be bleeding, will not have a 1 in 4 chance that she might be bleeding on her SAT. Because as a tiger mom and a doctor, I will make sure we move it around away from the SAT. And I will also give her the choice of if she wants to bleed at all. So please check out pandiahealth.com/periods optional. You could say Dr. Yen, an adolescent medicine specialist, did a TEDx talk. And if they don't like it because it's Pandia Health and it's birth control, you can go straight to Google and Google my TEDx talk and share with them this information that will improve your performance in tests, and also help your acne, also help depression, also help anxiety, is good for diabetes, is good for asthma, is good for seizure disorders, of having a stable hormone level rather than your hormones up and down. And so we're making birth control no longer birth control, but a way for those of us with uteruses to be on even playing ground with those without. Because those without uteruses don't get the horrible randomness of 1 week out of 4, and you don't know what day, what time, you don't know 3 days, 5 days. It's just random.
There was an article about that. It was like women have it was like several hundred periods within their lifetime on average, and I was like, that is sick. Like that, I mean, because men, or well, people without a uterus, they don't experience that, and that's just such an unfair thing. So being able to turn off
350 to 400 periods in our life currently, and we could take it down in my ideal world to like just the first 2 years because we don't want to throw the estrogen on too much. So like, and even then it's irregular. So you'd have like 24 versus 350 to 400. And then the realization I had is that 1 out of 4 people are bleeding. Women at all times, you know, 1 out of 4. On average, it's like 3. For me, it was like 5 to 7 days of blood. You know, if you're one of the blessed ones with 3 days, yay. And if you're on birth control, you could skip your periods, or even just being on birth control itself, not for birth control, hormonal treatment, it lightens your period. So if normally you were a 5-day period person, it goes to 3. If normally you were a 5 pad person or 5 tampon a day, it goes to 3. And the reason why is when you're not on hormones, your body needs to build up that lining of the uterus to catch an embryo. But when you're on birth control, it's just like level 2 thickness versus level 10 thickness. And so there's a lot less blood to get out. And so a lot less blood coming out and a lot less days of bleeding.
Which is really nice. It's really nice to be able to turn it off. And it's really empowering. I think a lot of people, I remember I feel like it's getting better, but I think when I was younger in high school, there's like a big stigma around it. Like, oh, you can't do that. Your uterine lining is going to build up. And then eventually you're just going to have to bleed. Like, why would you mess with your birth control? It's how it is because like, that's how it works. But that's not necessarily true. It's, that's just how it works. Your uterus is going to thin out. So your periods aren't going to be as heavy. And yeah, you won't need to have a bleed because you're not ready to catch an embryo. If you don't want to get pregnant, then you just go off of birth control. If you're like, you know what, I want to get pregnant. And I think that actually brings up kind of one final question. If you are on birth control, specifically pill, patch, ring, and then you decide that you do want to get pregnant, is there a good timeline to go off of birth control and try to have a baby?
Yeah. So what's interesting is so many people ask, will birth control make me infertile? And my favorite joke is, yeah, while you're taking it, that's why you're taking it. But the real question is, when I come off, will I have a hard time getting pregnant? And the answer is absolutely not. So what's really interesting is there's people, 1 in 10 women has or will have polycystic ovarian syndrome. And these women have weird hormones. Their hormones are out of whack and they can't pop out an egg consistently every single month. And for them, when they go on the birth control pills, it normalizes their hormones. So when they come off, that is the best time for them to be pregnant because their hormones are going to be the most normal at that time. And when they come off, it'll just get more abnormal. And in the old days, we'd be like, come off your pills for like 2 or 3 cycles before you try to get pregnant. And that is not the case for PCOS. It's like, come off your pill, have your bleed, do that build, go for the pregnant. And I gave a talk to a bunch of fertility specialists and I'm like, why am I even here? I'm like birth control. I'm the exact opposite of fertility. And they're like, no, we use birth control to normalize the hormone. And then we kickstart the women to get babies. So in no way does the birth control make you infertile when you're off of it. And in fact, it normalizes your hormones and helps kickstart it for those that might have polycystic ovarian syndrome. But the reason why doctors want you to be off, at least they like to know, we peg the pregnancy on your last menstrual period. And if you just have sex and don't bleed and we don't know, then we don't know how far along you are. Though certainly we can later measure with ultrasound, etc. But all of pregnancy is based on when was your last menstrual period. And that's how many weeks pregnant you are. Though really it's -2 weeks because 2 of those weeks you were building the lining.
Okay. Yeah, no, that makes sense. And it's kind of confusing when you think about it, but I think basically you can, long story short is that, right, you can, if you have PCOS, it's okay to have sex like right after. Well, it's okay to have sex anytime, but as long as you're careful. But otherwise it's that good time to plan. So you don't have to wait the 2 weeks.
Well, for the PCOS, you still have to wait you will bleed and then it has to build, right? But don't wait like 2 months. We used to say wait 2 or 3 cycles.
2 cycles. Gotcha.
Yeah. Sorry.
Okay. So that, no, you said it right. I was confused, but that makes sense. Cool. Okay. So that's kind of it. Before we go, did you have any final thoughts? Anything you wanted to share based on what we spoke about this evening? Birth control, accessibility, all of that.
Birth control accessibility, One thing I did forget to mention is that in 20 states, I kind of alluded to it, pharmacists can prescribe birth control, but in general, you need a prescription. You can't just walk into the pharmacy and be like, I want birth control pill patch ring.
Right.
These are controlled substances, technically, and that you have to get a physician or nurse practitioner or physician's assistant to review your history and write the prescription. But in 20 some odd states, pharmacists are allowed to do that. Either they have to have a contract with the doctor that said, yeah, you can write under my name, or the state just lets them, but they have to sometimes have special training. So even if you're in a state where the pharmacist can write the prescription, if the pharmacist on duty right then doesn't have the training, doesn't have the certification,
Right.
you may not get it. So if you are looking for pharmacist prescribed birth control, make sure the person is on duty, can do it. Otherwise it'd be embarrassing and a waste of your time. The other thing is, again, we only charge $20 once a year to use our expert doctors. Whereas if you go to the pharmacy, I've seen them charge more in general, 29, 39, 40,
Yeah.
50, or whatever. So again, from the comfort of wherever you have internet, be it your couch or your bed or wherever, you can use Pandia Health in 10 states to write the birth control pills. And it will soon expand to more states as we get more funding.
And we beat the pandemic. We were doing online before it became a thing. So now everyone's a pro at it. So perfect. Utilize our services now. And again, even if you're not in one of the 9 states that we prescribe to, that's okay. You can still get your birth control delivered. Still utilize our website and our blogs. Feel free to share that information with anyone you feel might benefit from it. Men, women, someone with a uterus, without a uterus. I think anyone can benefit from just being more educated on women's health topics, or not even women's health topics, just reproductive health topics in general, because it's complicated, but it's when you break it down, it kind of makes sense, and you learn that we deserve to have rights surrounding it. And Pandia Health is one step closer to that. So speaking of which, don't forget to follow us on social media at Pandia Health, nice and simple. LinkedIn, Facebook, Twitter, Instagram, YouTube,
TikTok.
we're everywhere. TikTok. We have a podcast, which you can listen to on Spotify, SoundCloud, and Apple, I believe. So check that out as well. We'll repost those a ton. So if you're like, where do I find that? Again, Pandia Health. And other than that, keep asking questions, keep checking us out, and sending us to people who you think might benefit. That's pretty much it. Thank you so much, Dr. Yen, for joining me this evening. And thank you for asking questions, everyone, for hopping on. And we hope you have a great evening. Thank you so much for joining.